This lecture is going to cover bone physiology. First, we'll talk about the structure of bone, specifically looking at structures of long bones and flat bones, and kind of go over kind of the histology of bone first, and also talk a little bit about the ossification process, and then we'll talk a little bit later about how bone is remodeled. So first, let's just look at the structure of the long bone. So in the long bone, you have the central diaphysis, which is the shaft, which you can see in the picture. Now, this functions as, it's very rigid, so it kind of has that kind of a structural function to it, so it's kind of provides rigidity. The each ends, you have the epiphyses. The proximal epiphysis is going to be closer to the trunk, and then you have the distal epiphyses. So you'll notice on this picture of the femur, the distal epiphyses, you're going to have the condyles, the medial and lateral condyles of the femur. The proximal epiphysis is where you're going to find the greater and lesser trochanter in the head of the femur. Now, the proximal epiphyses and the distal epiphyses, both are places where you're going to form joints or articulations. You'll also, they'll be specifically more in the proximal epiphyses. It will contain some spongy bone, and the spongy bone is a site where we have hematopoiesis that takes place, which is the formation of blood cells, like platelets and red blood cells and white blood cells. So hematopoiesis occurs in that spongy bone. You'll also have on the outer sides of the bone is the periosteum. Periosteum is just connective tissue, and it has actually two layers. The inner layer, which is closer to where you have the cavity, the medullary cavity, is going to be have bone cells in it. We're going to talk about the bone cells, so they refer to as an osteogenic layer. So we're going to talk about osteoblasts and osteoclasts later. The outer portion of it is going to help with protection of the bone. It's going to be a place where muscles attach, so that'll be a function of the periosteum. And when we refer to the inner layer, the osteogenic layer of the periosteum, that's going to be involved in bone remodeling, because you have the bone cells that build up the components of bone, plus also break it down. The inner part of the medullary cavity, you have the endosteum. The endosteum is also has the inner layer closer to the medullary cavity is an osteogenic layer, which has bone cells, which will be involved in bone remodeling. So it functions in bone remodeling also for the endosteum, but also serves as just an inner liner. The ends of the bones also have, and they're showing it more up here at the head, but you also have it down here, is you'll notice we have articular cartilage. Articular cartilage is hyaline cartilage. Okay, so that's the specific type of cartilage that you're going to see that is articular cartilage. Articular, or the term articulation, refers to be able to form joints. So the articular cartilage is involved in joint formation, and also serves as a shock absorber. The other thing that you'll see is they have it here listed as epiphyseal plates. So you see one here and one here. Well, there's a difference between an epiphyseal line and an epiphyseal plate. An epiphyseal plate is a place where it's pretty much a growth plate. And when long bones grow, they're going to use this endochondral ossification in bone growth, and the epiphyseal plate indicates the bone growth is still occurring. Once you have an epiphyseal line, that's just a remnant of a growth plate. So long bone growth has ceased. And I'm going to show you a little bit later an x-ray of an individual so you can see where they have epiphyseal plates and they don't have epiphyseal lines yet. Now, I also want to look at flat bones. Now, flat bones, like the bones in your skull, the frontal bone, the parietal bones, the occipital bones. Flat bones also include like your sternum and the ilium. These are pretty much composed up of compact bone, two layers of compact bone, and sandwiched in between you have some spongy bone. Now, if I go back here with this long bone, it's kind of hard because it's a small picture, but there's compact bone on the outsides, and you see spongy bone on the outskirts, or like up here, the ends. The spongy bone is where you're going to have the hematopoiesis that takes place. Now, one thing I didn't mention earlier is that you'll notice that in the central part of the diaphysis you have this medullary cavity that's filled with yellow marrow, and yellow marrow is fat. So it's just, that's what it contains, is fat. They come back here with the flat bone. So here's the flat bone, and in adults, that spongy bone that you see in the flat bones is the primary place where hematopoiesis takes place. In a young child, it would be within long bones, and they have a lot more red marrow, and that where the hematopoiesis takes place does occur in what referred to as red bone marrow. And you see that within this spongy bone. So in children, you see a lot more red bone marrow along the diaphysis, but as we get older, it's less and less, and you have to see most bone formation is going to take place within the flat bones as an adult. Now, if we want to look at the histology of the bone, look at the components of what bone is you look at this picture. This kind of shows you that we have majority of the bone is inorganic components. So you got calcium and potassium and magnesium and all these inorganic components. Then you also have the organic components, which is mostly collagen. You're going to have cells, that we're going to look at some of the cells, but also collagen. Now, collagen is going to be what's responsible for providing the high tensile strength. You learned early on that collagen was a fiber that was part of cartilage. And so what was the function of the collagen is it does provide a very high tensile strength. So you apply a lot of tension to it. It's going to take a lot before it breaks. So the osteoid is the term we use for the organic components, which is primarily collagen. That provides the high tensile strength to bone. Also what you'll notice if you look at the chemical analysis of bone is a large percentage, huge percentage of your total body calcium is with bone. So that will be kind of serve as a storage of calcium that we're going to discuss a little bit later. Now what I want to do is not only talk about the collagen, but I do want to talk about the other organic components, which would be the cells. So you have osteoblasts. Actually, we start with the osteoprogenitor cells. These are stem cells. So these can become osteoblasts, and they have the ability to divide. They undergo mitosis and you can produce more bone cells. Once you become an osteoblast or an osteocyte, you no longer can divide. The osteoblasts, you'll see lining kind of around, they're going to be, you see on this picture, right in here, along the edges. So you see these osteoblasts. So you'd find them along cavities, like the medullary cavity, or on that osteogenic layer of the periosteum. So they're on the kind of the ends or the sides of the bone. And what they're doing is they're the ones that are going to be producing or putting down the organic components of the matrix, the collagen. Now what happens is as they secrete collagen, they're going to form the bone matrix. They eventually kind of surround themselves, and I always say they paint themselves in a corner. And so they kind of get isolated, and then you see here, you see they become osteocytes, which are the mature bone cells. They're going to be more they're still, people think, oh, they're not very active, but they actually are, is they're just going to be doing normal day-to-day activities. They're still going to be involved in kind of keeping the bone happy. And we'll look a little bit later at the model of the bone that we talked about in lab, and you remember the canaliculi, the little canals, is they have these little canals, and then with osteocytes can talk, and you can have nutrients that are going from the central vein that we're going to talk about, and also kind of go through the different components of the bone. Now another cell that's important in bone physiology is here the osteoclasts. The osteoclasts you see here, they're huge, very, very large cells. They are multinucleated, means they have tons of nuclei because these guys are needing to produce a lot of different enzymes. They're going to secrete acids, and their job is to destroy the bone, break it down. Don't think it's a bad thing. When you remodel bone, you need to break it down and then build it back up. But we do not want is too much osteoclast activity and not compensate it with osteoblast activity. Then it would lead to loss of bone. All of these cells are going to be involved in just normal growth of bone when you're a child, development of the bone, and then when you're an adult, more maintenance of the bone and repair in case your bone gets broken. The inorganic component is going to be, they refer to collectively these mineral salts as hydroxyapatite crystals. Main ones I want you to remember is calcium and phosphate, specifically calcium. The mineral component of the bone, the inorganic component of the bone, provides the really hard, the rigidity of the bone. If you start losing some of that calcium and the phosphate and the other mineral, the bones will become soft. They won't protect you as much as they should. So they're very, very hard. So that's what the inorganic component, the function is provide mainly hardness and rigidity. Now here is a picture of the microscopic picture of bone. And this one should look very familiar that you've seen when you do in lab. To me, it looks like you cut through a tree trunk. And I'm going to kind of look at it with a diagram and kind of look at the different components and kind of what their functions are. So bone is very vascular. You break a bone, it's no problem to heal it because it is so vascularized. Now the bone is so hard, you don't have to worry about blood vessels getting kind of compressed like you say what we saw and talked about in tendons. You'll notice is out here on the outsides we have some blood vessels. Well, that periosteum, one of the other things it does, it kind of supports the blood vessels and nerves that are coming into the bone. And you'll see these come in through on the sides, they refer to them as the Volkmann's canals or perforating canals. And then they come up through these central veins you see here in the middle. Now so you have these blood vessels bringing nutrients to the bone, but also picking up waste products. Or in case if we need to break down the bone, if I need to get to the calcium and any other stuff that's in the bone, it needs to go into the bloodstream. But you know, these circles that you have is referred to as an osteon. It's the kind of the functional component of the bone. So here would say a full osteon, which you see they're pulling up here. And around each osteon, you have these layers, they're called concentric lamella. And what you're seeing is primarily the inorganic components and collagen in the bone. And of course, this picture's not showing you really well, but we do have the osteocytes that would be found within little lacuna. I wonder if you see, we're going to go back here. Is you have, here you can see over in this picture, over on this one over here better, is you see the little lacuna and the osteocytes would be sitting in there. So here's the picture, you see this right over here, this is the central canal right here, and right there, and right there. And this concentric lamella would be kind of come around in a circle. But allow you to communicate between the concentric lamella, you have these little canaliculi. They kind of come up like spokes like a wheel. So you can have some movement of nutrients and things like that from one layer to the other. Now in between some of these osteons, you see these things called interstitial lamella. Those are remnants from bone remodeling. When you had breaking down of bone and then building them back up, you're forming new osteons, and so this is just the interstitial lamella are just remnants of the osteons. You also do have circumferential lamella out here on the outsides, and hopefully you remember that from lab when you looked at the bone models in lab. Now the two terms that I want to talk about is in regards to bone development and growth is the terms ossification and calcification. So you're going to want to write this down. So ossification is a term we'll refer to when you convert a tissue to a bone, something else to bone. It could be some sort of membrane to a bone, and that would be intramembranous. It's some sort of a sheet-like material. It's still going to be connective tissue. And the chondral is when you're going to convert cartilage to bone. So that's the process of ossification. There's two types of ossification that we observe, is endochondral and intramembranous. Calcification is where you deposit calcium within tissues, and that happens a lot to different people. I've seen where people have aortic calcification, and the aorta, which is a blood vessel, and it's very elastic artery. If it becomes calcified, it becomes rigid, which is not what you want in an aorta. So some tissues and that's just not the only place that it becomes calcified. So there's a difference between calcification and ossification. So there's a slight little difference. Now, most bones in your body were formed from endochondral ossification, which means they began as a hyaline cartilage model, which then eventually was replaced by bones. But the skull bones, except the mandible, they're your broad, your flat bones, they were developed from, we refer to as intramembranous ossification. So it was kind of like a sheet-like membrane connective tissue that eventually was converted to bone. I'm going to show you what endochondral ossification looks like, since most of the bones in your body developed from this model. Now, growth in long bones definitely occurred from the hyaline cartilage model. And what happens at that epiphyseal plate that I had mentioned is the epiphyseal plate is allowing for the bone to lengthen. So you think about it, a child, how tall they are, and eventually how, as they grow and grow and grow, their legs are getting longer, their arms are getting longer. How does that happen? Well, you have cartilage cells that reproduce. They undergo active mitosis, and they're constantly reproducing themselves, but on the epiphyseal side of the plate. So epiphyseal side is going to be, like in this, it's going to be up here towards this part. And then what happens is they get broken down, destroyed, and then replaced by bone on the side referred to the diaphysis. And what happens is continues on, and bones will continue to start like here, and they're going to get longer, and they're going to get longer, and get longer. Okay, and so what you're seeing here is you're seeing the osteoid and is the pink. Osteoblast is kind of hard to see in here, but you see cartilage cells, and those cartilage cells should look familiar because you know what hyaline cartilage looks like. So the cells are constantly, the cartilage cells replace themselves, but eventually they get destroyed on the other side and replaced by bone. Now, the bone growth can be affected by a number of different things. So there's a number of different hormones, and I'm only going to mention a couple of them, but growth hormone, that one makes sense. So it's involved in growth. Some of your sex hormones will be involved in bone growth. Insulin, you have to have the proper diet. You got to have certain vitamins that are going to be important in bone growth. So many things can affect a person's stature. Is part of its genetics, part of it is their environment, what they were exposed to, what they ate, or anything affects their endocrine system. Now, bone growth, long bone growth, should end by about age 25. And what we'll see is that cartilage in those long bones will be completely replaced by bone, and instead of having an epiphyseal plate, you're going to have an epiphyseal line. So I'm going to show you these x-rays. The picture on the left is someone who is still growing. Person on the right, the long bone growth has ended, and this is, you're seeing just an x-ray of the hand, which is commonly done if they're, I had my daughter had this done because I thought she had precocious puberty. She was just developing too very, very young, and so they take an x-ray of the hand, and because of the I thought it was excessive amount of certain sex hormones, that with some of the sex hormones, they can end up closing your epiphyseal plates a little bit too early. So they can check and look at the x-ray and kind of determine rough age of a person by looking at an x-ray, determining whether or not they have the epiphyseal plates or lines. And what you see on the left, they call it epiphyseal cartilage, is because cartilage won't show up in an x-ray. Bone will. So if you look at on the left, you see some spaces in there. And you see there's a tiny little space on each side. So you can see it like so like right here, you see a little space. You see little spaces here. But notice these are all closed up. These are closed, okay? So that could be used to just check to make sure, in case of my daughter, see if she was kind of developing or bones were developing a little bit too fast. Another little story to tell you is in regards to sex hormones. Both sex hormones are definitely important in bone growth. The estrogens tend to close the epiphyseal plates earlier than testosterone. So as you think about girls, they stop growing a little bit sooner than boys. They have a lot more estrogens. Boys do have estrogens, and it's important for them to have some estrogens. But you do not want to expose boys to too much estrogens too early. So we used to have a person that worked in our lab. He was a resident in endocrinology, and he had patients coming in. They were pediatric endocrinology, and they would come in, and you were seeing a lot of these boys with breast development. Very young boys, very, very young boys. And they careful talking to the mothers. Common theme was these boys were mothers that were going through menopause, and they were doing estrogen replacement, and they were doing the cream. So they were putting estrogen creams on them. The thing is, if you touch your child, the child it'll be absorbed through their skin. So these boys were being exposed to heavy amounts of estrogen way too young. Now the breast development, yeah, you can surgically fix that, but what they were worried about is the boys not being able to attain their proper stature because of the excessive estrogen exposure at a very young age. So that's from that study, they were able just to do more talking to patients and mothers that were in menopause and telling them you have to be careful what type of estrogen replacement you do if you're going to have children at a later age. Now, one other thing I'm going to talk about before we kind of stop this first part of the webinar is I want to talk about appositional growth. So long bone growth, things are just you're going longer. So here. So that would represent long bone growth. Appositional growth is you're going from here, a little bit wider, a little bit wider. So it's more about thickness or diameter of the bone. Or if I did cut the bone, say here's the bone I cut, and I'm going to look down this way. So here's the bone, and here's like that. So here's the medullary cavity. So it's getting wider, a little bit thicker, and a little bit thicker, a little bit thicker. So that's appositional growth. Appositional growth responds to stress. Think about when you looked at your long bones and all the markings that you had to look at, the tuberosities, the tubercles. Those were response to stress where you had tendons and muscles attached. So bone responds to stress by making more bone, making it thicker to make it stronger. This is what you actually do want is anytime you do any type of weight bearing exercise, it helps to promote appositional growth, which is extremely important if you're worried about developing osteoporosis. So if you do weight bearing exercise, swimming is not a weight bearing exercise. So you have to be on land. Can't go up into the space. That won't work either because you have to have gravity. So doing that kind of helps to keep bone a little bit thicker and stronger. Now here, I'll stop. I'll do this one more and then we'll stop for now. Is bones are remodeled all the time. So in response to stress, you exercise, you do weightlifting. It responds to your diet, blood calcium levels. If your blood calcium levels are too low, you have to maintain an adequate level of blood calcium so you'll break down bone. So there's different things that can cause bone to be remodeled. Now here, I want to just look at, for instance, the people who can lose bone is if you're not active. You're not doing weight-bearing exercise. You're bedridden. You're not stressing the bone. You're going to lose bone. So that's why I say get out and exercise. Astronauts, because they're in weightlessness, they need gravity. So astronauts that come back from Earth have to worry about loss of bone. Women are going through menopause or after menopause. Estrogens, one of the things estrogens do is they prevent, referred to as apoptosis of osteoblasts. And osteoblasts are very important in building up bone, and they kind of prevent that. Thing is, after menopause, when your estrogen levels get low, you're going to lose those osteoblasts and you're going to lose that ability to help to maintain your bone density. And also any condition that causes you to have low blood calcium levels, because you have to maintain adequate levels of blood calcium because it's important for a number of different things. So what they're going to do is that low blood calcium levels is going to trigger hormone release, which we'll talk about in the next webinar, to cause you to break down bone. So one thing that can cause low blood calcium levels would be obviously you're not eating enough calcium, you're not taking enough calcium in your diet, but also things like vitamin D deficiency, because vitamin D helps you absorb calcium through the GI tract. So we're going to talk about that in the next webinar.